A good night's sleep is very essential for our physical and mental health, for the quality of our waking life, for our immune system, for brain and heart health, for creativity, vitality, and even our weight. 48% of women with PCOS has sleep apnea as compared to 25% without PCOS. I am Dr. Seema Arya, consultant sleep physician, extensively involved in assessment and management of people with various types of sleep disorders with a special focus on insomnia and sleep apnea. So why do we talk about sleep? Why is sleep so important? A good night's sleep is very essential for our physical and mental health, for the quality of our waking life, for our immune system, for brain and heart health, for creativity, vitality, and even our weight. Even a minimal sleep loss can have a substantial toll on our mood, our mental energy, and our ability to take decisions. So helping people sleep better will go a long way in helping them to lead a healthier and a happier life. Today we are going to talk about two distinct medical conditions: Polycystic Ovarian Syndrome or PCOS and obstructive sleep apnea, OSA. Polycystic Ovarian Syndrome or PCOS is a hormonal disorder affecting females leading to menstrual irregularities, fertility issue, acne, obesity, and hair growth. Whereas sleep apnea is a sleep disorder where there are multiple interruptions in breathing during sleep. Though these two conditions are distinct, there is evidence that there is association and correlation between two of them. And why do we say that? Because there are certain common factors which are seen in both these conditions. Both the conditions are more prevalent in overweight and obese individuals. Insulin resistance is seen in both of them. Hormonal imbalance and inflammation can also be seen in both of them. Though these conditions coexist, but doesn't mean every woman with PCOS will have sleep apnea or vice versa. In a woman having PCOS, OSA having coexisting will depend upon age, body weight, and other comorbid conditions. So there are various studies which have been published showing prevalence of sleep apnea and PCOS. In 2019, there was a study published in Clinical Journal of Endocrinology which showed that 48% of women with PCOS has sleep apnea as compared to 25% without PCOS. There was another study in 2017 in Clinical Journal of Metabolic Disorders and Endocrinology which reported a prevalence of OSA in 30% of women with PCOS. So why do we talk about this correlation and why is it important? So there are certain complications associated with each of these conditions, and when these conditions coexist, these complications are amplified, and there's a huge risk in patients where these two conditions coexist. For example, in women with PCOS, there's increased risk of cardiovascular complications. So when sleep apnea coexists, there are multiple interruptions in breathing, leading to oxygen saturation, leading increased stress on the heart and increasing the risk of cardiovascular complications. Similarly, hormonal imbalance is seen in PCOS. Sleep apnea can amplify this hormonal balance, leading to increased risk. Metabolic disorders, there's insulin resistance. Disrupted sleep pattern can add to this insulin resistance, increase the level of sugar in the blood, and there will be increased risk of type 2 diabetes mellitus. Sleep apnea can also add to hormonal imbalance, and quality of life and mental health is affected in both these conditions. A daytime fatigue and disrupted sleep pattern can add to the psychological symptoms already seen in PCOS like anxiety and depression. So how do we manage this? It is very, very important for people to realize when they have these two diseases, when they coexist, to talk to their doctor and tell them about all their symptoms so that they can be addressed. Maybe a multidisciplinary approach is required to give a comprehensive care to such patients, which may be led by a collaboration of gynecologists, sleep specialists, endocrinologists, and dietitian. So I'll put forward some strategies which will go a long way in helping these patients lead a normal and a better life. First is lifestyle modifications, in which the most important is weight management. Any reduction in weight will definitely lead to a better sleep quality. And reduction in weight can be done by regular physical exercises, which will promote weight loss and better sleep quality, and dietary modifications. A balanced and a nutritious diet will go a long way in helping improve symptoms in both these conditions. In special, this thing should be taken about carbohydrate intake, because it leads to insulin resistance. It does affect them. In a patient with OS, sleep apnea, the mainstay of the treatment is continuous positive airway therapy. This involves wearing a mask on the nose or nose and mouth, and delivering a continuous stream of air, which will help in keeping the airways open and thus improve the quality of life in a patient with OSA. In PCOS, for hormonal imbalance and fertility issues, treatment can be taken in form of birth control pills and other medications, which will help improve the menstrual irregularities as well. One more important thing is about sleep hygiene practices. Sleep hygiene practices are very, very important, though not much importance is given to them. Good sleep hygiene practices involve a comfortable and cool room to sleep, fixed sleep wake schedule, avoiding stimulant drinks at night, avoiding electronic devices, taking dinner, which should be the lightest meal of the day, 2 hours prior to the bedtime, so that the reflux also doesn't disturb the sleep. Regular physical exercise, limiting daytime napping to about 30 to 45 minutes will help maintain the circadian rhythm and biological clock and your sleep cycle during night. Cognitive behavior therapy can help in the psychological symptoms which occur both in sleep apnea and PCOS, which will definitely help in both the diseases. So, management of complications, treatment, following a fixed treatment plan, and reporting any new emerging issues, and making lifestyle changes will go along, which is essential for long-term management of both these conditions. Thank you.